Hello everyone, my name is Divya Devi Anand, Assistant Professor, Department of Psychology, Dr. MGR Educational and Research Institute. In this video, we will be seeing about the clinical picture of schizophrenia, like what schizophrenia is, some of the symptoms, and how it is diagnosed. We'll see DSM-5 criteria in detail. We'll also be looking into some of the common myths and misconceptions that are attached with this disorder. So, buckle up and let me dive into this important topic. Before getting into the clinical picture of schizophrenia, I would like to show you some cases of schizophrenia. So, for the first case, there's a young woman who's sitting in a college classroom hearing voice of God telling her that she's a vile and disgusting person. The second case, where a middle-aged homeless man walks on the road alone, his clothes are in tatters, he's wearing a torn clothes, he seems to be talking to himself, claiming that government of India is spying on him. Uh, in the third case, you are trying to have a conversation with a supermarket bagger, but he's giving you a blank stare and he speaks in a very toneless voice, like barely, well, like one or two words is coming out of his mouth. Then in the fourth case, we have a 30-year-old man covering his laptop camera, claiming that the aliens are recording everything that he does. So he wraps the camera in red cloth and keeps it inside his cupboard. Okay, so all of these cases might look funny, weird, or silly to you people, but these are all cases of schizophrenia. So, schizophrenia is a severe psychological disorder characterized by psychotic symptoms, and these symptoms significantly affect their emotions, behavior, and most notably their cognitive symptoms like cognitive cognition. Both the mental process and the contents are affected. It affects how a person thinks, feels, and behaves. So, it is a complex condition that involves a range of symptoms like delusion, hallucination, disorganized speech and behavior, and sometimes like apathy, lack of motivation. All of these things you could find in a person who's having schizophrenia. So, people with schizophrenia may experience disruptions in their thought process, which can make it difficult for them to communicate clearly or make sense of the world around them. So, they may also experience changes in their mood and emotions, and because of that, they may struggle with social interactions. So, this word schizophrenia, it was coined by Eugen Bleuler, and this word has its roots from Greek. So schizo means split or crack, friend means mind. Because Eugen, he believed that this condition is characterized by disorganization of both thought process and the reality. Okay, so you're getting split off from the reality. Schizophrenia is inevitably, it has a devastating effect on the lives of the person who is affected with the disorder and also on the family members. So, taking care of them is a huge responsibility, and having them well fed and controlling them and keeping them in the community, they'll have to be answerable to a lot of people. Like, not all neighborhoods are friendly or accommodative. Um, they'll have to be answerable to everyone around them, and most often the society, it always devalues people who are having schizophrenia, um, maybe because of media or popular culture, because they often portray people with schizophrenia as violent and unpredictable, uh, and this portrayal can always, it can lead to fear and misunderstanding, which can again reinforce negative stereotypes, and it will also contribute to devaluation of these people. Sometimes these schizophrenics are, yes, as said, they are unpredictable. They shout, they scream, um, they throw tantrums, they run out of their homes. So it is hard on the family members' part, and definitely taking care of them, the cost of medications, all of these things would definitely take a toll on the mental health of the family members. So, coming to the symptoms of schizophrenia, the symptoms are initially classified into two categories, that is positive and negative symptoms. Now, recently we are also focusing on cognitive symptoms. Okay, so first we'll look into the positive symptoms. Positive symptoms are nothing but excess, um, like it has been added to a person's normal behavior. Okay, so positive means plus, so which means that something is added to a normal person's behavior, like either in thought, emotion, or behavior form. Hallucination, delusion, disorganized speech, disorganized behavior, all of these things come under positive symptoms. Negative symptoms are basically minus, deficits. Okay, so these negative symptoms are characterized by loss of normal behaviors. Okay, so normal person usually shows expression in his face as motivation to do certain things, shows some kind of emotion, socializes. But if you are lacking, if you are experiencing loss in all of these normal behaviors, then that comes under negative symptoms. Okay, so again, these deficits can be in thought, emotion, or behavior. Then we have cognitive symptoms, which involves problems with thinking and processing information. People with schizophrenia, they experience difficulties in memory, attention, and also problem solving. They actually have trouble in organizing their thoughts, and they may experience a sort of disconnection between their thoughts and actions. And that is what we call it as splitting off from the reality. So the positive symptoms are basically pathological excesses or bizarre additions to a person's behavior. Okay, so a person who is having schizophrenia, definitely they would be having at least one or two positive symptoms. And these positive symptoms are hallucinations, um, which are distortions of perception, and then delusions, which are distortions of thought. Then, thirdly, there is disorganized speech and behavior. Now, we will move on to the negative symptoms. Negative symptoms are a group of symptoms which are characterized by loss or reduction in normal behaviors or abilities, as I said earlier. So, unlike positive symptoms like delusions and hallucination, which involve presence of unusual behaviors or experiences, negative symptoms will involve absence of normal behaviors. Okay. Um, One of the most common negative symptom is avolition, which refers to lack of motivation. So they won't find any motivation in doing activities that they initially enjoy, like withdrawing from social groups. Um, they would have some hobbies or interest. Now they won't find it interesting. They may lack motivation to even get up from the bed, to take care of themselves, or to go to school or work. It would be very difficult for them. Next is alogia. Alogia is basically reduction of the amount of speech. The vocabulary would be very, very limited. They use repeated words. Their the vocabulary would become very, very restricted. flat effect is basically not showing in any emotion. They may appear to be very, very inexpressive. They may have this poker face. Even their voice tone would be very, very flat. Anhedonia, it is basically lack of pleasure or lack of interest. You will lose interest in things that initially interested you, that initially brought pleasure to you. Okay, so these are the common negative symptoms. These negative symptoms are actually difficult to treat and may even persist with medication and therapy. Now let's look into the DSM-5 criteria for schizophrenia spectrum disorders. With this video will get over. So I'll go with the first criteria. So two or more of the following for at least 1 month period of time, and at least one of them must be delusion, hallucination, or disorganized speech. So, for at least 1 month period, the person should experience active symptoms of delusion, hallucination, or disorganized speech. Then, fourth symptom is disorganized or catatonic behavior. Then, fifth is negative symptoms. Okay, so among the one, two, three, at least one of these three things should be there for 1 month period. Next is because of these symptoms, the person a normal life would get affected. So there would be some dysfunction in the normal functioning. So impairment would happen in major areas like work, relationships, and then self-care. So completely their normal functioning would be disrupted. The third criteria talks about the duration. So, so the duration must last for a continuous period. So the actual duration for schizophrenia is 6 months time. So this 6 months period should include at least 1 month of active symptoms like full blown delusion or hallucination or disorganized behavior should have been there. And then the rest of the 5 months, the person may have milder symptoms or residual symptoms. Fine. So this duration is the one thing that differentiates schizophrenia from schizophreniform and brief psychotic disorder. If the person is experiencing psychotic symptoms for less than a month, the person might have brief psychotic disorder. If it is lasting for more than a month but less than 6 month period, then the person might have schizophreniform disorder. If it is lasting for more than a continuous period of 6 months, then that is schizophrenia. And if the person is having mood disorder symptoms like mania, depression, if this person is having those symptoms as well, then that is schizoaffective disorder. Okay, so you should know the differences between schizophrenia, schizophreniform versus schizoaffective. Okay, so if you know the differences, it would be easy for you to rule out those conditions during the diagnosis process. And then this disorder shouldn't be yet another medical condition that is caused because of medication side effects or substance side effects. Those symptoms shouldn't be the side effects of um, substances or medication. So you'll have to rule out that option as well. Okay. So with this DSM-5 criteria is over. Lastly, we'll look into the epidemiology of schizophrenia. With that, we'll finish off this video. So the risk of developing schizophrenia over the course of lifetime is under 1%, and this schizophrenia is more common in men than in females. But in India, the statistics are different. We find more of women affected with schizophrenia. This may be because of um, the centers that are there for women. There are more number of centers that support women who are having mental illness like schizophrenia. Even in Chennai, you can find many places that help destitute women with schizophrenia and other medical condition. But when a man who is affected with schizophrenia, we often like we don't care about them or we don't bother about them. Um, we just think them that they are just alcoholics, or we don't usually uh, admit these people, or don't usually foster these men who roam around aimlessly in the roads. Probably they might also have schizophrenia, but there are no support centers for men in India. So that could also be the cause for some the differences in the ratios. Um, in children, the cases are rare. In men, the peak age where the symptoms we could see is around 20 to 24, while in women it is around 40. This may be because of estrogen hormone as well. Okay, so pre-menopause period, they may experience a lower level, they may experience psychotic symptoms, and that may lead to schizophrenia, and this could be because of lower amounts of estrogen in them. Okay, so with this, epidemiology is also over. So I hope I was clear in explaining the clinical picture and epidemiology of schizophrenia. So with this, I'll sign off from this video, and I will continue the etiology in yet another video. Thank you.